The choice about whether or not to get an epidural during labor is totally a personal choice, but one you should make with education that you receive from your doctor and other healthcare providers at the time of labor. Pain is such a subjective thing and everyone experiences it differently. And in most cases, it's going to hurt more during labor than you might think, especially if it's your first baby. You don't really know what to expect. And labor is usually the most significant pain a woman has felt up to that point in her life. We talk to patients a lot in the hospital about their pain on a scale from 0 to 10 and ask them to rate it. And oftentimes first-time moms will say their pain is a 10, even when they're 1 centimeter, because again, they just don't know how bad it's going to get. Now, with that said, there are plenty of women who deliver without using any form of analgesia, whether that be IV pain medication or an epidural, and they make it through. But there are definitely pros and cons to getting an epidural, and it depends on you and the type of situation that you're looking to be in when you're in labor. Obviously, one of the greatest pros to having an epidural is that your pain will be controlled. Now, a common misconception of epidurals is that they relieve all sensation. But a good epidural is actually one where you can feel pressure. You may know that you're having a contraction, and this helps when it comes time to push. Women who go into it feeling like they don't want to feel anything, sometimes are disappointed by the fact that they still feel pressure knowing they're contracting. But it doesn't hurt. It takes away the pain. Now, with that said, again, epidurals aren't perfect. A lot of times you have to be redosed during labor and receive just a little bit more medication to keep you on top of the pain. And they also work by gravity, and we keep you on one side or the other over the course of your labor because that's the position that's the best for the baby. It really doesn't have a lot to do with the fact that you had an epidural. So the side that's down will start to, become more numb. The side that's up may hurt a little bit more. And so we flip you over and give you more medication, and that evens out the pain control so that you're comfortable. One of the possible downsides to having an epidural that people consider is the fact that it makes it so you can't move. You can't walk around. So you may have a little bit of control over your legs, enough to shift yourself in the bed, but you can't get up and walk. And so some people look at that as a con. And you do need to have a catheter in place to drain your bladder for you. But it goes in when you're numb, and it comes out when you're numb. So as far as you're concerned, it never existed. There are also other benefits to having an epidural. There are many studies out there that have been done to show that epidurals slow the progress of labor, which they can if you get it too soon. But they can also speed up labor, because if you can't control your pain and breathe properly, in fact, if you don't breathe properly and take in enough oxygen and blow off the proper amount of carbon dioxide, it messes up the carbon dioxide and oxygen balance in your blood. And that affects all of your organs, including the uterus and circulation to your baby. So it's very important to breathe properly. Make sure you're in control. If you're not in control, then it's a good time to start thinking about an epidural, because it can halt your progress. I've taken care of patients who have been, 7 centimeters for 4 hours until they get an epidural, and then 20 minutes later they're 10 centimeters and ready to push and have their baby. So there are instances where it can speed it up. Again, there are times when it slows it down if you get it too soon. A lot of doctors feel that another benefit to getting an epidural is that when it comes time to push the baby out, you're able to do controlled pushes instead of when you don't have an epidural, just that instinct causes you to push as hard as you can with all your might, and oftentimes that increases your chances of tearing. So in some cases, recovery might be a little bit better after having an epidural. Now, as with any procedure, there's always risks, and the biggest risks are infection and bleeding, but many things are done to reduce this risk. And we know that a possible side effect of an epidural is having your blood pressure drop. So in efforts to decrease that effect, we give you a lot of fluid beforehand through your IV. And this increases your blood pressure so that when it drops from the effects of the epidural, it keeps it even. And if it drops a little bit lower than we expect, there's easy ways to bring it back up, and it's usually inconsequential to you and the baby. Possible risks of getting an epidural. One of the biggest ones is a spinal headache. And this happens 1% of the time, where afterwards you could have one of the worst headaches you've ever had in your life, but it's not permanent and there are easy fixes to it. There are also other risks that can be associated with the placement of it. The medication could go into a blood vessel that's in your back, and the anesthesiologist is likely to ask you after they've finished with the procedure, do you have any ringing in your ears, funny taste in your mouth, dizziness, those sorts of things. Those can be indications that it's gone into a blood vessel instead of into the epidural space. And so the anesthesiologist would just try it again, place it in the proper place, and get you comfortable. In very, very, very rare circumstances, it can cause a little bit of persistent numbness and tingling after the initial time period where your epidural should have worn off, but this is about 1 in 10,000, and so again, it's very rare. If you have more questions about epidurals, be sure to ask your OB provider and the nurses and anesthesiologists at the hospital when you go to have your baby. They'll be happy to answer your questions and assist you throughout your delivery, no matter what your choice is, an epidural or no epidural. If you have any other questions for me, feel free to ask them on our Facebook page at facebook.com/Intermountain Moms, and recommend us to your friends and family too.